This conference will
Can
now be recorded.
you
Yeah,
please
continue.
confirm your name and age, please?
Yeah, I'm Nana. I'm 18.
All right, Nana. First,
Hi.
I want to apologize you as you have been referred here to see the consultant. However, our consultant has been, called for an emergency, and I am on his behalf to go for the consultation today. Is it okay to continue?
Yeah, that's fine. Yeah, no problem.
All right, and is it how may I address you?
You can call me Nana, is absolutely fine. Yeah.
Okay, okay, Nana. Nana, can you tell me in your own words, what are your concerns and expectations out of this consultation today?
No, the thing is that I'm currently in my 12th grade and haven't got my periods yet. It has been a little concerning. My parents are also getting a bit worried. So we decided that we needed a checkup actually, which got delayed by for whatsoever reasons. And I wanted to know what the GP's test results are.
All right, all right. Yeah, yeah,
Yeah.
Nana, definitely. And may I ask you, how's your school going?
Yeah, it's fine. Yeah.
Okay, nice. Yeah, I can gather from your GP letter that you have been referred here as you told that you do not have your periods yet. And
Mhm.
definitely I'll address all your concerns and I will discuss the reports with you. Before that, is it okay if I ask you a few questions?
Yeah, that's fine. Yeah.
Okay, Nana. Okay, can you tell me more about, like, I can see that you're 18 years old. Do you have any complaints other than like periods? What I want to know, what about your waterworks?
No, I don't have any problems other than the periods.
Okay, okay. Any pain during any episode, any monthly tummy pain you're getting?
No.
Okay, and do you have any other problems with the waterworks like pain while passing the pee?
Pain while passing urine? No.
Okay, no, no worries at all. And as you told me that you have been seen by your GP, has he discussed any reports with you?
No, that's what he asked me to meet the consultant about.
All right, Nana. Okay, can I ask you a few intrusive questions?
Yeah, sure.
Nana, may I ask you, are you sexually active?
I am not.
Okay, okay. And do you have any medical illness of concern?
No.
Any drugs you are on?
No, nothing.
Any allergies?
No.
Okay, do you have siblings?
Yes, I do. I have two elder sisters actually.
Okay, have they got their periods normally?
Yeah, in fact, that was added to my worry actually. They both got their periods at 12 years of age.
Okay, okay, okay. And do you have any family history of concern, like any other family member in your family has got the same problem?
Of not getting periods? No,
Yeah.
no,
Yeah.
I'm not aware.
Okay. And do you have any surgeries in the past?
No surgeries.
Are you aware of your weight to height ratio?
23.
23. Okay. Okay. All right. And may I ask you, like, do you smoke?
No, I don't.
Any recreational drugs?
No,
Okay. With whom do you live, Nana?
I live with my parents.
All right. And how have you been feeling during the past 4 weeks? Everything fine at home?
Yeah, yeah, things are all right.
All right, Nana. Thanks for giving me this information. Is it okay if, with your permission, I can examine you in the presence of chaperone? I will have a look on your blood pressure and your general examination
Hmm.
and the free
No, but
and
the
tummy
GP has
examination.
already done that for me.
Okay, that's no worries. Yeah, I can see that he has also written to me, and
Yeah.
everything seems to be normal.
I
Okay,
just want to know what he found. Like he looked a bit worried.
okay.
Yeah.
Nana, I can see now. Coming to discuss your reports. Are you alone, or you have your parents or friend with you so that
No,
I
I'm
can
by
give you a
myself
lot of
because
information.
they were busy today, so nobody is here. But
Okay.
you can tell me.
Yeah, Nana. Actually, I'm worried that I have a concerning news for you.
Oh, what? Sorry, what is it?
Yeah, Nana, I can just see your reports. And first of
Uh-huh.
all, yes, I can get the other page. Yeah, I have your
Oh,
several
yeah, sure.
reports with me. First is the blood works, and
Yeah.
that are normal. Okay, this is the hormonal levels like FSH. These are the blood tests which are quite normal. And I've
Mm-hmm.
confirmed your test with your name and NHS number. And
Uh-huh.
another one is the genetic testing, which shows us about the genetic makeup of your cells. That is also
Right.
quite normal, 46XX. Okay. And now your X-ray has been done of your wrist, and that is showing a little bit, there are some changes in the bone of the right hand. Okay. And also, Nana, I have got your spatial scan of the pelvis, that is the MRI. And I'm sorry to say that for that I have some concerning news for you. You know, Nana, I can show you this on a diagram. Like you can see, this is the normal, system of the female. We have got like two egg baskets, okay, as you
Mm-hmm.
can see on the diagram. And
Mm-hmm.
normally, there is a womb, okay, that is known as the uterus, and the
Mm-hmm.
neck of the womb, okay,
Okay.
and then after there is the vagina. So
Mm-hmm.
the scan has revealed that there is no
Yeah.
there is no womb. Okay, the womb is not visible as well as the neck of the womb.
Mm-hmm. Eh,
Yeah,
sorry, I don't understand, doctor. What do you mean by it's not visible? Was there something wrong with the
yeah.
test?
No, actually, I mean to say that it's not identified. That means it's not present. It's absent, and this condition is we call it as an MRKH syndrome.
No, but how can that be? I don't get it. Are you saying I'm born without a womb?
Sorry to say, I'm so sorry to be the to say this. Yes, Nana, this is a condition in which a woman or a girl is
Oh
born
God.
without a womb.
But doctor, why did this happen to me? And what does this mean?
I can understand, Nana. You're in a distressed situation. I really understand your concern. However, we are here for you as a team to help and support you. I'll definitely I'll address your concern. What happens? This is actually this happens when there is the development of the womb. Once the girl is in the like in the before the girl is born. Okay.
Oh, okay.
Yeah, yeah. There occurs some abnormal differentiation of the cells so that in the structure from which the womb normally grows, it's not different, it's not like we can say, it doesn't get, normally developed into a womb.
Oh God. I don't know what to do about this. What does all this mean, doctor? That means I'm not a girl. Uh,
No, Nana, there is nothing to do. The individual, whether it's a male or a female, it doesn't entirely depend on the presence or the absence of womb. Your genetic material is quite normal, okay? It's not the only conformity or identity of the female. It depends on how you think, how your, behavior is, and what is the genetic makeup of your cells, and
but
that
at
is
least
quite
it will
normal.
mean, will I ever be able to have sex, have relationships, have a pregnancy, have a family?
Yeah,
I
Nana,
want
I'll
to be
discuss
through all
all.
that.
Yeah, Nana, first of all, the concern which you had that you didn't get the periods yet, it's because of this reason that there is no womb. Okay. Now, relating to the, sexual life, there is the vagina is well developed and there's no problem. There will be no problem in the sexual intercourse as the egg baskets are normal as well as the vaginal canal is normal. Am I clear so far, Nana?
Okay, okay, yeah, that's at least
Yeah,
that
Nana.
is reassuring. Yeah.
Yeah,
Yeah.
and also, once they grow up, if the patient or the woman with this condition, they happen to have a baby, there are other options available by which they can have the baby. Do you want me to discuss this with you?
Yeah, of course, yeah.
Yeah, Nana, there are as you have the normal egg baskets, your ovaries are quite normal and healthy. So we can get the eggs from them and then fertilize, fuse them with the sperm of your future partner in the lab. And what we call as sorry, I mean to say there are two options. One is the surrogacy. Yeah, we take the eggs from your egg basket and fuse them with the partner sperm. Then we can, we can then transfer to the womb of another woman, and
Mm,
through that's known as the surrogate mother, and
mm.
they can give the baby of your, which is related to you. Okay.
Oh, okay.
Yeah, yeah. Another option is the adoption. There are many babies who just want some loving parents. Okay, so this is the another option.
Mm,
That's the adoption. Okay, am I clear so far,
right.
Nana?
Yeah, yeah, yeah.
Do you have any other questions to ask me?
Uh, well, doctor, I mean, pretty much it. I just wanted to know why this periods were not
Yeah, Nana.
happening.
Yeah, Nana, I know this is a distressing situation and it will be very upsetting for you at the moment. I'll connect you to the counselors and the support groups, and there are many women with this condition and
Okay.
they live quite normally.
I'm
Okay,
hooked.
and I'm giving you this
Yeah.
little information.
Yes. All right. Okay. Yeah. All right. Dr. Taskin, do you have any reflection on the task?
Um, Information gathering, I think related questions, I didn't ask much.
Hmm.
Mm,
What additionally do you think is important?
um, Although I asked about the like other
Overall, how do you
causes,
find the task? How do you find the task, and did you find it like easy to perform? What was it?
uh, it was like a known task, knew about this topic. So that was a little bit, relaxing. However, I get confused while like addressing it for the first time.
Right, about how to say it and how
Yeah,
to
and
break the
how to
bad
explain
news
the
and
things.
things.
Yeah, how to explain in a lay language,
Right,
that
right.
your womb
Yeah.
is
So,
absent.
yes, without it being a complete shocker to the
Yeah, without
individual
sensitizing.
the news. Okay. Let's take some suggestions. Maybe Dr. Om Priya is here, I think. You're trying to join. Yes, she's here. Do you have any pointers or suggestions, how this news can be broken?
Uh, hello, ma'am.
Yes, hi.
Um, okay, like breaking bad news, we can ask her. Can I, ma'am, say?
Yes, yes,
Hello,
yes,
hello,
go
Nana.
on.
I can see that you are alone here. Do you have somebody to accompany you?
Mm,
Uh,
okay.
then I'm afraid I don't have good news actually. Your blood tests have come as normal, but the MRI which has been done, it shows that the womb is absent, although your egg basket
Oh,
or ovaries that are
at this
normal.
point, I'm crying. I
I'm so
just
sorry,
received
Naina.
a very massive piece of information, and it was just, dropped on me, basically. What we are trying to ask is how to soften this news or how to build the anticipation, because
Okay.
this is something which can cause a lot of distress to somebody who hears this for the first time, right? She's not come here
Yes.
anticipating that. Yeah.
Yes.
So, any thoughts around that? This is exactly what Dr. Taskin also did, right? Just now.
Okay.
So, do you have any
Okay.
suggestions how that can be improved upon?
Uh, we can comment about that your breast development, pubic hair, and everything is normal, but
Okay, okay.
when is absent, we have to say. Hmm.
Fair to say that the womb is absent, but are there some things that you can say before that, maybe, right? So, okay, we'll get to this to the communication part of the station just in a bit. But before
Okay.
that, we will discuss about what all points come under information gathering and also patient safety perspective, additional things that can be there. Okay. So
Yes,
let's start with the beginning of this station. Now, in information gathering in this particular condition, as you know, there isn't much from a etiology perspective. At the most, you did ask, as Dr. Taskin did, about the family history which is there. Now, MRKH has two types, you know, MRKH type 1 and type 2. This falls under type 2 category. Okay. You don't have to know the nitty-gritties of things, and then also the you know, in-depth knowledge about the genetic makeup and which gene is responsible. All those things people might try to, you know, tell you and say that you have to know this, otherwise you're going to fail the exam. No. Part 3 is about being able to, in general, cover the uh, pain points which the patient is coming here with and able to make a sort of a safe management plan. As long as you're a safe ST5 and you're answering and addressing those things which are being asked by the role player, you should be fine. Okay. Additionally, you have to think about other you know, implications of the news that you're giving them, including towards the end. You ran out of time before talking about the counseling and support and all those things. They are very, very important in the marking schema of things. So often students find themselves, you know, being able to tackle the main issues or getting into too much depth of things which need not be spoken or need not be said in the station, which are really required from a part 2 point of view to know. But part 3, you can easily pass the stations if you're just a fair doctor and you're able to communicate empathetically. All right. So to begin with, did you notice my name, Dr. Taskin? Hello? Hello? Guys? Hello?
yes, ma'am. Okay.
Dr. Taskin? Has she left?
Yes, ma'am. Yes, ma'am.
Okay. Yeah. Okay, with the child. Okay, that's fine. Yes, so my name
Yeah, with
is
the baby.
hmm, my name is Naina Mathur. So basically, an 18 years of age. So you have to start off the station by paying attention to all these details which have been given to you. So it's a young person, and it's relatively late for somebody to show up with a primary amenorrhea at this stage, right? So on the background, actually, there is the information that I did, you know, start to consult at the age of 14, but because I'm from India basically and traveled to the UK 4 years ago, and I didn't get appointments owing to the pandemic, and that got delayed on my end, and that is the reason why I presented now with the investigations to you. Okay. So now, the other thing which is essential, can anybody guess what needs to be asked, which comes as a point in patient safety right at the beginning of the station?
Need for interpreter, madam.
Yes.
Yes, exactly. So you have to confirm first that how would you like to be addressed? May I confirm your age? After this, you ask, are you comfortable to talk in English? Should I arrange an interpreter? Okay, extremely important. And then you ask general questions to a young individual, right? You want to know, you want to get a feel of what you are dealing with exactly. So, currently, what is it that you are doing and how are things? All right, it has to come from your end. Hmm? So, that interpreter offering comes under patient safety as a point. and asking about the language barriers and all. The general inquiry would come under information gathering. Okay, so those are marks that you will have to gain. Now, then of course you have apologized for the consultant not being there today. So, and that's again in patient safety. And you ask permission to proceed fine with communication. So we are going to mark you accordingly. Now, ask her open-ended question about why she's here, right? So can you tell me in your own words about your complaint? So she says that I basically didn't get my periods and I want to know it's taken forever for me to get the appointment. What is wrong? What are my tests saying? So you can ask again, if the person is too anxious, okay, sometimes they want to know the reports early. In those scenarios, you at the most can ask permission to proceed with questions only once. And if she says, no, no, tell me my reports, please break the news. Okay, we'll tell you how to break the news in a beautiful manner just in a bit. Okay, so then you say, please don't worry, I'm here to help you. I would like to ask some questions and proceed with the information gathering. At this point, you are already aware that you have some intimate details to ask her, right? Some personal life and everything. So when you signpost for that, okay, always also at the same breath assure confidentiality to the patient. Okay, the skin. I think I told this last time as well. Mm, yeah, so okay, no need to unmute. I know that there's some background noise there, so it's fine. But if anyone has any queries, then you all can unmute and ask, okay, rather than writing in the chat box. So then you ask about if she has any background information about the investigations, if that has not been clearly established. All right. Now, next, so basically you will ask if GP investigations, is there any, is she aware of reports that way? Okay, either of these questions is fine. And then the history is pretty brief. You have to ask any medical disorders that she's having, as you did, any treatments that she has received in the past, medications, etc. Okay, any surgeries she has undergone. All right. Now, Dr. Taskin, you asked me monthly tummy pain. Do you think it's relevant? Here, no. Hello. Okay, let's ask the others. What history do you all think is relevant here, apart from the general template? Okay, all right. Everybody is silent. Okay, so basically, any history which is not concerned with this particular walking inside the state with a diagnosis, you already know from all your relevant information provided that this is MRKH. Okay, you know that there's absent uterus and absent cervix, blind ending vagina, and you know that ovaries are normal, everything else is fine. Okay, so when you're walking in with a diagnosis, there is no need for you to, ask differential related. So you wouldn't be, for example, asking about cryptomenorrhea. Reason being that you know that it isn't a transverse vaginal septum. Okay, so that plus this pain while passing urine would not be one of the um, one of the symptoms for even if you're asking about congenital abnormalities associated with the urinary tract. Okay, in fact, the patients more often than not will be asymptomatic for that. Okay, so for a condition which is associated with MRKH type 2, you will have urogenital structural abnormalities such as one kidney may not have developed or may be hypoplastic. Okay, and the urinary tract, that is your um, ureter and structures are not developed, but more often than not, she will be asymptomatic for the same. So if you usually till the age of 18, if she has reached without that, then she is unlikely to even consider or know that one of the kidneys is absent. Okay, so you will generally ask any surgeries or any problems with your water works, but it's not pain while passing urine. That would be inappropriate. You ask problems with your water works or medical disorders or kidney related disorders, that is fine. That way the examiner knows that you're thinking about this. Okay. So then you say that GP has already examined you and noted that there is normal breast and pubic hair development. Ask her, okay, as a routine part of inquiry with this, what age breast development started and what age pubic hair development started in her, if she remembers that. So your thelarchy and your pubarchy are important in terms of a sexual development history in this particular patient. I agree, it will not change your diagnosis in any manner, but you want to inquire about these things. Okay, is that clear, everybody?
Yes, ma'am. Yeah.
Okay, yeah. What about the rest?
Yes, ma'am. So we need not ask any
Okay,
questions, only routine medical history, surgical history, drug allergy, and water walks, and what
yes,
age breast and pubic hair development. No
yes,
negative history needed.
and
Okay.
what she asked, which I'm coming to, which was very beautiful question, which is about the sexual history, right? It's very
Sexual
important.
activity. Yes, yes.
Yeah, so
Okay.
it's very important. Don't mind me asking some intimate questions. If you haven't signposted earlier, you will signpost now. The first question in any sexual history has to be, what does it have to be? How will you open sexual history?
Are you sexually active?
Are you sexually active?
Yes. Are you sexually active directly also works if you've signposted and you've gotten comfortable with your role players. Otherwise, you have to see, you have to judge the situation. Sometimes, sorry. Sometimes you can proceed with, are you in a relationship and are you sexually active? That's one way. Or you can proceed directly, are you sexually active? Because you're not making any sort of assumptions about the patient and you are asking this very open question. And then depending on that, usually they are very talkative now with a longer script. So they'll say, no, yes, whatever, I've been with my boyfriend like this is it. So in this situation here, she has never, okay, had a sexual relationship. Okay, and that becomes important. I'll tell you why, okay, as we proceed with this station. And ask about smoking, alcohol, recreational drugs because age group and the standard history. And BMI just in general because they can drop this as a risk factor in any station, okay, randomly. So and that is important to be covered here. Was everything was normal, and ask about how she is supported, okay, rather than asking who do you live with, which becomes a sort of a one-stop answer. I'll say I live with my parents, then you will ask, are you well supported? No, okay, it's not required. Just don't build bad habits is what I'm saying. In all stations, you will have a standard approach. And as the exam comes near, or while you're performing circuit, you're doing 14 tasks one after the other. Okay. If by chance you've cultivated any sort of like habits which kind of, dig a grave for your own self, okay, that should not happen. All right. So you try to eliminate all those things, negative things while you're practicing now. All right.
Ma'am, you mean we have
So
to
yeah,
say, are you well,
are you
supported
well
at home?
supported is enough. Yeah.
Yeah.
Are you well
Okay.
supported is enough history. Okay. So then one second. All right. Thereafter, you just confirm with her if things are, anything she would like to mention. What does she want to know exactly? Which you did very well, and I appreciate that. Okay. Then breaking bad news steps. Step number 1 and 2, everybody did. Is there somebody here with you? I have some confirming information, concerning information to share here with you. Okay, but after this is where the trick lies. How can you soften this news? So depending on certain scenarios which are very disastrous news. Like, for example, if you've hysterectomized a patient, right? You've done obstetric emergency hysterectomy. And that's a very devastating sort of news. Baby dying is devastating sort of news. So you can't just, say that your reports are done here. I've confirmed your name and NHS number, and it shows that your womb is absent, or this thing is present and your womb is absent. Okay, so you build up to that thing, build their expectation that something is coming, which is in the form of a bad news or something that they might not be expecting or to hear. Okay, how did you build up to it? The second warning shot that you give, the first warning shot that we always give routinely is we have concerning information to share, right? That's one warning shot. That kind of, what is a warning shot? It tells the person who's sitting in front of you that bad news is coming, right? So you can even go up to using 2 or 3 warning shots when such news is there. All right. So what you need to do, and the easiest way to do this is think to yourself, if you get a news station anytime you want to give a warning shot, think and explain what is normal. Okay, what would normally have happened and why periods happen. So you say that I confirm that this report belongs to you with your name and NHS number. I would like to draw and show you. So in girls, there is a womb, there are tubes on either side, there are ovaries which have eggs in them on either side. Remember, you're talking to a very tender age person. She's just 18, she's quite young. Okay, so you need to also modulate your tone in that fashion. You're not talking to some 30-year-old woman, right? So you need to also pay attention to the language used. It has to be very, very simple, right? So the womb has a neck which opens into the vagina. Got it? Then you check for understanding. Okay, see what she knows, doesn't know. If you need to clarify anything, all of these things you will do at that point. Okay, the skin, right? All right. So then periods are nothing but the shedding of the inner lining of the womb due to hormone changes. And what you do is, you know that different sort of thoughts are going to come to her mind after. So you can counter them at the beginning before you break the news. So you will say that not all girls are born the same, maybe. All right. Some may have different development. This could be uh, genetic rare instances there where the womb, neck of womb tubes, okay, may not develop normally. These are usually formed by fusion of the tubes in this of 2 structures in the center, and they may not be formed in certain individuals. And girls are born with this. So try and use the word girls, women more often when you're doing so. Okay, so that you're trying to normalize that this can happen in girls as well, because otherwise you'll have the next question, which will be, okay, so I'm not a girl, what is this? Then immediately after that you countered that saying that no, no, your genetic makeup, this is same. But before that happens, there is a better way of approaching it. All right. So the ovaries are still present and working well. So you say which is normal in her, normal and functional in her, and what is still there, which identifies her to be female as well. So ovaries are still present. They're working well, producing eggs in the female hormone. And this condition, okay, where it doesn't develop is called as MRKH. As such, your hormone levels tested are all within normal range, but the scan which was done, okay, special scan which was done, is showing that you have this particular condition. I'm sorry to say that we are not having the womb, etc., etc. Okay, all right, the skin.
Yes, ma'am.
Um, yeah, okay. Thanks, Ompriya. All right, can you repeat that for me, Dr. Ompriya?
Yes, ma'am. Yes, ma'am.
Hmm.
Uh, One stop. Okay, so Naina, I can see that you are alone here today. Do you want somebody to accompany you? I have some concerning news for you. Okay, so first let me tell you how the normal periods happen. So this is the womb, and this on the sides, which has the neck of the womb, which opens into
Mm.
the vagina, and we have tubes and the egg baskets, two egg baskets on one on each side. So how the womb develops is that two tubes they fuse in they join together, and then the womb is formed. Sometimes which they may fail to develop. So not all girls are born equally. Some the tubes fail to develop, and so the womb is not formed in such in these girls. And periods are nothing but shedding of this inner lining of the womb due to hormonal changes. So when
Mhm.
the womb is absent, the periods don't start. So I'm afraid that in the special scan that we have done for you, the womb is absent, although
Mm.
the egg baskets are present, due to which you have the hormones as like that of a girl, and that's why are having the normal breast and all the hair development. Are you with me,
Okay,
Naina?
great. One small modification is that
Yes, ma'am.
before you say you don't have this, say what you have, right? So you said that
Okay, okay.
interchangeably. So,
Yes,
or the good has to come before the bad. That we
yes,
soften the blow of this situation for her. The moment you
yes.
say that boom is not there, you are
Mm-hmm.
going to expect a reaction from the role
Correct.
player, any role player. Okay, no
Yes.
matter how
Mm.
brilliantly you did the Breaking Bad news, they are still going to, because it's
Mm.
there in the script. They have to give you a reaction, one 30-second reaction, 45-second reaction, but they will give it and they will wait. Okay, um,
Yes.
they are marking you on communication based on how you take this reaction, how you respond to it. Okay, so that
Yes.
is nothing, the reaction is nothing to worry about, and it doesn't reflect that you broke it badly or anything. Okay, so you don't get scared of the
Yes.
station, you proceed, and you are going to then go and ask her, okay, am I clear? Uh, and do you need me to explain again? Something like that. So she'll say, no,
Yes.
okay, don't have womb, I can't have a normal. So what all did I see? I asked all my complaints in one shot. I said, so that means I can't have a relationship, I won't be able to have sex, I won't be able to have children, complete my family, can't do any of those things, right? So
Mm.
you need to listen to that very carefully and say that these are the concerns. Now, uh, here's where Dr. Taskin, you made a mistake. Okay, you said that very much so. You have a vaginal passage and you can have a sexual life. Okay, so is that realistic, or could you have, or should you have said something different?
The vagina is 3.6 centimeter. It is short, so she may need vaginoplasty after she starts having relationship. How if there is any difficulty, she may need a surgery to
May need, yeah, may need, but what is
may need.
more
Yeah.
commonly required? They do have some sort of difficulty. You need to tell her
Mm.
that yes, this is something which is a concern in individuals who have MRKH. And then we have what is reassuring is that you can have a sexual life, but some treatment modalities will be required. And then you explain what all will be there. So if you finish the station fast, the reason was that you didn't cover this entire aspect of things. Like fertility is, of course, if she asks you have to, I can't have children, say that I'm really sorry, but the womb is necessary for carrying the pregnancy. But despite not having the womb, there are options like adoption, surrogacy, wherein another woman can carry the pregnancy for you. As such, you have the ovaries functioning, so the eggs can be taken from you, and a test tube baby can be formed. This has to be a very short, brief answer, because right now she's not asking like, okay, fertility is my main concern. See, you have to try and get the gist of the station, what you need to speak exactly in the station. How do you know that? She's just after receiving this news, her major concern was about having sex, right? Then she's worried about, okay, then all these other things, not having family, they come up. So you need to discuss only the options which are there. Okay, in fact, the fertility can come later. The sexual life, which is our major issue, could be addressed first. Okay, so and additionally, also third option, please mention and keep is uterine transplantation. Okay, now as per the AUFI talk, these three you will have to speak of. Got it, Dr. Taskin? Okay.
Yes, ma'am.
Right? Yeah. So, but that this option is in its infancy. And how will you know if there are marks for talking about these things? You just ask them, would you like to discuss anyone in detail or something of this sort? All right. So if there is more marks for any of these options, they will ask you specifically, yeah, I want to talk about surrogacy. Okay. Otherwise, don't proceed with it. Hmm? So enumerate all the things and then you ask the role player for their opinion and things what they want to know. All right. If she still says no, I'm not a girl. How am I a girl? I'm not a woman. This sort of things you need to again clarify, saying that as I've said earlier, you're very much a girl. It's just that all girls are not born the same way. Then you do have eggs, ovaries, hormones, and the genes which indicate that you have a female sex, okay, assigned to you. And then next about her sexual life. So MDT is one point which is going to be always there in your patient safety domain, right? So we'll need to address you in a multidisciplinary team, by which we mean that specialist team of doctors, including your surgeons, gynecologists, specialist nurses, counselors, all of these individuals will come together. All right. And we have to assess if the vaginal passage below is open and has enough length to allow penetration. All right. So, first step would be to assess. You can't directly tell her that no, individuals, you will have a difficulty or won't have a difficulty. Say that we assess this. If it's enough length, which is there, you might not have a difficulty. In most girls, we are able to create a longer vagina by just stretching the small amount of vaginal tissue which is already present. Okay, so this is usually done by specially designed smooth cylinder-shaped objects created for this purpose, which we call as vaginal dilators. And if not, then one passage can be created with surgery, and then this needs to be maintained in the open stage using the dilators and regular intercourse. Okay, so all these three options will be done when the woman is ready to become sexually active. Okay, so majority of the cases, remember, first you will speak of the simpler treatment and not surgical directly, like dilators come before speaking of plastic. Okay, got it?
Yes.
The skin, yeah. Look at the skin. Am I clear? Got it. Any other questions anybody has this time? Okay. So a majority of the patients they show success with dilator therapy, as I said, and as such, surgery also has certain risks like injuries to internal organs, infection, bleeding, and it can be painful and requires long-term dilator use, sometimes even multiple surgeries. So that is the reason why the dilator uses tried first. It can be a long course of treatment. So a clinical nurse specialist will be assigned to teach you and support you while using the dilators. All right. Okay. So you offer all sort of support and things to these women when they are going through this dilatation therapy. Hmm? So yeah, when you do have intercourse, she has to remember. Is there anything else that you need to tell her about this? Because sexual activity is her main concern there. Priya? Let me see if I know the big.
The psychosexual counselor.
Yeah, sexual counselor is there. Additionally, there is one thing that you need to tell a young individual, which you need to also remember in this case. Tell her that whenever she does have intercourse, penetrative sex, then she would need to continue using condoms. She cannot assume that she is protected from STIs. Somebody wrote that in the chat box. Very good. Shara, San, Asma, very good. Okay, good job. So we are coming towards the end of all the points that we have to cover here, and you must always remember that these things are difficult for people to deal with. So you have to offer counselors, support groups, and written information that you could do before the station closes because you might run out of time towards the end. Okay, if you're very much sure that you're finished on time, then you can keep it for the end, or you can sometimes it's better. Okay, a good habit to try and cover this before the station closes. Um, and additionally, yes, the other points which are in applied clinical knowledge would be to talk about the kidney issues. So you have to tell her that this MRKH is associated with other abnormalities, including kidney issues such as an absent or a small kidney on one side, and radial hypoplasia, that is bones of the thumb side of the forearm and thumb may not develop properly. Your X-ray has confirmed that this is there. We would also need to involve an orthopedician in your care, okay, and see if surgery could be offered. So you're not saying that you need to get operated for this. You will just mention about a referral to the orthopedician. So you see how the station is very simple, but there are marks hidden here and there, okay, which if you don't look at the patient holistically, then you may tend to miss out on these things. All right. So it's not just about, telling her that you have MRKH and knowing that, um, what MRKH is and what the options are right now, but there is additional information provided to you here. In type 2 MRKH, you specifically can have renal abnormalities and also structural abnormalities such as radial hypoplasia. Okay. So, and she comes from India, so probably that, I mean, they may have, sort of written it off like that because of that. Okay, she's never undergone any sort of an orthopedician consultation or surgery for that as well, right? She mentions that in the beginning. So she would need an ultrasound or an MRI to look for the formation of the kidneys as well and a further referral. So you need to get all these points in your belt in order to successfully score your 2 in all domains. Okay, all right. All right, so Dr. Taskin, it's a very positive sign from your end that you volunteer for the task and you're quite confident with doing these. If you just add a little finesse to your tasks and complete them and you know what is being marked, okay, think over these issues, then definitely you will do much better. All right, my hour is up for today and
Hello, ma'am.
yes, Ompriya.
Hello. So do we,
Yeah.
Tashkin asked about the siblings and their menstrual history. Do we like need to ask it? Ask that?
Um, Yeah, to get family history, actually, she was asking me, I believe. That
Okay.
was the intention
Okay.
behind it. So it was
Okay.
not that, there can be a genetic link. So therefore, she was asking if I have sisters, then they need to be also, she's screening through history if they are also
Okay.
having problem or not. Got it,
Okay.
no?
Okay.
And then she
Yeah.
can offer that way. In that way, it will of course help. But she asked about the sisters, and I said that they both had normal menses and all, so it came out of. Got
Okay.
it?
Okay. Yeah.
All right, yeah. So yes, thank you everybody for joining in. Any other questions out there? Okay.
Thank you, ma'am. Great
All
session.
right. Yes. Thank you. Thanks, Ompriya. Thank you.